Hi there and welcome back to my office. I sincerely welcome you here. I hope you get comfortable. I've been thinking about it recently, but I hope this setting, my office, brings you some comfort, brings you some confidence as we gain knowledge here. Because I understand for most people, the doctor's office, let alone a butt doctor's office, is not the first place you think of to get some solace, some comfort. So again, I hope this place does not give you increased anxiety. So I am Dr. Albert Chung. Let me introduce myself. I'm a board-certified colon and rectal surgeon, or a proctologist if you prefer. Let's do some chatting about anal spasm and anal muscle injury, anal pain from these conditions here. I've done some detailed videos on this. What is it? What are the basic treatments of it? But I want to focus more on the surgical options today. So you may be seeing your family medicine doctor, your GI doctor about this condition, but they'll be trying different things. Maybe they'll have a colonoscopy or something, but I guarantee most commonly, you'll be misdiagnosed, or the doctors will be looking at you with a blank stare. They'll be looking at your butt, if they examine your butt, and they'll be looking at you and say, you know what, I don't know where your pain is coming from. And then they'll refer you to a surgeon. And so when you get to that point where you're on your last straw here, you tried everything, nothing seems to work, surgeon may recommend a treatment called the sphincterotomy, or the LIS, the lateral internal sphincterotomy. And what they do there, and whether it's open, laser, what technique they do, it's pretty much the same result. They go find your internal anal muscle or sphincter. They cut on average about 1 centimeter length worth. And what happens is that muscle, which is a circle, they cut it and it opens up because the tension is now broken. So that part of your muscle that's cut no longer has the strength it used to. But that's really the point, is that if you have spasm, your muscles are tight, then we want to loosen it. And if nothing else has worked, then we got to cut it and break that tension, right? This is a permanent change, as I've said before in my other videos. That muscle will not come back together. It doesn't find each other and meet and shake hands again. It's broken. It's open like that. So you will notice a difference when you put your finger in your bottom end after things heal, of course. That beginning outside part, a little bit looser, but then it's going to get to the more inside, and then you find the tightness there, because that's what the muscle does, is contract and close the opening. The data and the literature is very, very unclear about this. And even ask your doctor, hey, how successful is this going to be? And the doctor will tell you, maybe not, you'll get better. The thing is, we tried everything. So this is really the next step. And yeah, you're going to be pretty disappointed with that response. But the studies are so small, with very small groups of patients, and diagnosis of this condition, how you classify people with the different ranges of pain, where their pain is coming from, very difficult to get a straight answer as to whether this is going to work or not. And I want to discuss this in detail because I don't think it works. I do not believe that sphincterotomy is a good option for this condition. And I want to explain it to you, but let's talk about Pranicura, because guess what? Patients have been using this for anal spasm and muscle pain from anal spasm. It's not just for hemorrhoids and fissures. As I talk to people, I'm learning all the time, which is really what I should be doing, as being in this profession, is learning. I think my feeling is the reason why it works is because of that menthol action, cooling things down, decreasing some inflammation and some of that fullness sensation, and distracting you away from that pain, which is why people say, gosh, you know what, this stuff actually makes me feel better. Now, they also have other great agents in here to help soothe the skin, right, and help soothe the area. I think that menthol is part of the key here, to distract you and then allow that muscle to feel better so that it can relieve that spasm. So give this stuff a try. It's not just for hemorrhoids. If you've got anything going on your bottom end, This is completely safe because it has no prescription agents in it. It's very, very low reactivity with the ingredients, the organic ingredients, and very natural ingredients in here. So give this a shot, and you can only find it at www.pranicura.com. And I'll bring this up later at the end of the video, but again, I think this would be a great context to also use this cream as well, as many other people have found. So explain the logic here, right? Is when you have anal spasm, the muscle is squeezing, but the muscle that's really squeezing is the internal anal muscle, which is what the sphincterotomy procedure is done on. How long is that muscle? Well, that muscle, if you think about let's use my fist here. If you think about the anal sphincter muscle, it's got some length, 3 to 5 centimeters, but that internal one, a little bit shorter, so maybe about 3 to 4 centimeters long, right? So you've got this distance here of the sphincter muscle. And what part of it is spasmed? What part of it? Is it just a little part of it, or is it all of it? And in my experience, based on examining many of these people with this condition, it's the entire length of the muscle. All of it, all 3 to 4 centimeters. So when you get the surgery done, I told you that it only cuts the outside, the very bottom part of centimeter of that muscle. So you cut that part out, you have about 2 to 3 centimeters left of that muscle, but what have you done to address the spasm in the 2 to 3 centimeters that's on top? Nothing. The sphincterotomy has only addressed one little bottom part of it, a portion of it. But what about the rest? What's the treatment going to do to cure or treat that other part of the muscle? Are you going to cut all that muscle? Definitely you won't find a surgeon that's crazy enough to do that. Why? Because if you did that, instant incontinence right away, and you're going to soil, you're going to poop, fart everywhere, even at night. So definitely not. You got to have some muscle intact, but that is why this surgery, in my opinion, will not work. Okay? Will you find some relief? I think that some people will, but will it cure it? I don't think so at all. Why do people find relief? Because that little part of that muscle that is released, well, that muscle can't spasm anymore, can't tighten and really cause pain anymore because it's been opened up. So yeah, some people can find their pain is improved a little bit from that surgery, but does it solve the problem? Or are you just doing a partial job? And in my opinion, it's not an acceptable procedure. And so I do not do the sphincterotomy for this condition, because I don't think it works. What's a better option then, Dr. Chung, if you think you're so smart? Well, in my opinion, you've got to address the entire length of the internal muscle, because if you just do, again, the small little part, that rest of it's got nothing. So I inject Botox. And what does Botox do? It paralyzes muscle chemically. All right, people do it in the face, and the reason why it works is because it shuts down those muscles. So that's why people look wrinkle-free and beautiful. And the anus here, what I do is I inject it inside the muscle. And when that happens, the entire length of the muscle is treated, because I put that needle all the way up and even further than the top of the anal muscle. I can get into the pelvic floor above your anal muscles with that needle and treat all of those muscles that can definitely cause issues with you feeling like you can't poop. You have to strain really hard to get it done. Your poop is super small, like a little pencil thin stick. All these symptoms can be very well addressed with Botox injection, as long as it's injected properly and in the right places, and you address all the length of the muscle that's having the spasm and the pain injury there, the pain symptoms. And I think that is the treatment. Again, another thing too is that Botox is temporary. So can you get another injection if it wears off? Yes, you certainly can. Can the anus be restored after having Botox done? Yes, because in 3 months it runs out. It's not permanent. Whereas the sphincterotomy, boom, cut open, done. That's it. And You know, I've even heard of some patients getting 2 sphincterotomies done, okay? I'm not sure exactly what the surgeon is doing at that point, you know, where they're cutting, or they're cutting even deeper, more internal muscle, but that's where you're really increasing your risk for incontinence, because you are damaging more and more muscle. I don't think it's a good idea at all. And so I don't have much data to back this up, but I'll tell you this. Patients that I've injected Botox for this condition have really helped them. And I don't think it's because I just inject in the anal sphincter muscles, but because I inject so high up into the pelvic floor, which is very, very commonly associated and in collaboration with this dysfunction of the internal anal muscle. That's why it's so helpful. So I'm going to be making more videos on this topic, obviously, because it's such a huge thing, and I'm learning all the time. But I'm certainly so relieved for my patients when they say they don't have to live in their sitz bathtub anymore, that they are feeling better. They can get back to work again. They can go back out to eat because they're not just laying in bed, just terrorized in pain. That gives me confidence that I've got something here, that I've got an answer for these patients with this chronic pain problem. And so I hope that this office brings you some confidence and some strength in your recovery. I'm so glad you came to join me today, and give this Pranicura a shot. I use this stuff all the time for my fissures and hemorrhoids, but guess what? It works for anal spasm and anal pain as well. Crazy, I know. But believe me when I say my patients have told me in the office, and you'll see reviews that patients use this and have gotten some relief. So you can only get this on their website. They do not distribute through Amazon. You've got to get the quality stuff direct from them. They control the quality and the supply, so you can be confident that yours is going to be good the day you receive it. Again, contact them, www.pranicura.com. Thanks so much for being here. Bye-bye.